All right, whether you have dentures that you absolutely hate or you just lose a single tooth, either way, you need a replacement and you want it like yesterday, right? Well, mini dental implants are a great option to get your smile back to looking great. Dr. Richard Boatman knows a thing or two about them. He's from Troy Family Dental, and he is here to explain the benefits of mini dental implants. How are you, sir?
I'm doing great. It's good to be here.
Let's make sure we all start from a level playing field here.
Yes.
Mini dental implants, what are they?
Just as the name implies, they're mini. They're very, very, very small, and they are just absolutely changing many, many lives. Because they're so small, they're much less invasive. There's much less discomfort, much less time. Less time in my chair means less money that you have to pay. And they're just, they're amazing.
So I'm trying to look for a disadvantage because it's less time in the chair for the patient, which is good for them, more economical for them because it's less of your time out of your day. I guess perhaps there are just some cases where you need the more traditional implants because of a particular case, but
there can be, but very, very, very few. These are, I think this is the way implants are going to be going.
And you've got them all laid out here because there's such great versatility and customizability for people. So give me some examples of what we're looking at.
So one of the most common applications we have are people with lower dentures. There's just not much to hold on to down there. They float. Never met a patient in 32 years that liked denture glue.
No.
So we can put 4 mini dental implants in. A couple of months later when they're healed, we can place snaps in their denture. We can snap that denture into place, and now they no longer have to wear denture glue. They can bite much better, and changes their life. On the top, a lot of people have a severe gag reflex, and their palate is covered, so they don't taste their food. So if you go to Dairy King, you're not going to enjoy it as much.
That's unacceptable.
It is unacceptable.
I will not allow that to happen.
Absolutely. So when we place mini implants on the top, we can remove that palate. Now no longer do they have the gag reflex, but now they can actually snap it in, taste their food much better, and chew and bite a lot better also.
That's great. So go to town on the fresh apple or the corn on the cob.
Absolutely.
And what do we got here?
Well, actually, for patients that want something that feels a little more natural, we can actually make a porcelain bridge that will snap onto these minis, which is much smaller in profile, much harder material, and you can actually bite my finger off if you use that right there. So you don't want to get too close.
Why would I want to do that?
Well, I don't want to make you mad, so we don't do that.
Never tick off a guy in a llama sweater.
That's right.
All I'm saying. And even individual teeth or a smaller bridge. Yeah.
Yes, a single tooth, or a lot of people have 3 or 4 teeth missing, and they have a partial denture that they don't like, so we can place a few little mini dental implants. A couple of months later, when those are healed, we have this little bridge made. We cement that into place. That is cemented in permanently and doesn't come out, and it's just like their natural teeth. For a fraction of the cost, fraction of the time.
Why wouldn't you do this?
Absolutely.
And very economical. So, Doctor, thank you so much for coming in. And happy holidays to you.
Happy holidays to you.
Christmas, too. Yes. I'll return the sweater after the show. Thanks for letting me borrow it. To make an appointment with Dr. Boatman or Dr. Spencer, our other buddy over there at Troy Family Dental, call the number that's on your screen right now, 618-477-8421. You can also find them on the web at troyfamilydental.com. It's funny, Laura, the more these guys come on the show, the more I realize that people I know in my personal life or go to church with or whatever are patients of his.
I'm not surprised.
They're all over the Metro East and Missouri for that matter.
And you guys have been around a long time doing great work. Thank you very much, you too.